what I have seen and what is really disturbing is that in India we are seeing lot more of younger patients, so-called bad news. In my opinion, it's not after all so bad. But yes, it seems like as if it's the end of the line. Mean it is cancerous, all right? But 20% of the times it could be cancerous, where timing is very important. The fear which is there either in the patient or in the family members is completely fictional. It's all in their mind. If a mother breastfeeds a child, it is protection for the mother against breast cancer. I think I will go for a vada pav.
Vada pav? Oh.
I'm a total Mumbaikar. जो जी को अच्छा लगे उसको कहो हाय, जो अच्छा ना लगे उसको कहो बाय, मुस्कुराहट को कहो हाय, घबराहट को कहो बाय. Love you zindagi.
Hello and welcome to today's episode of the Health Talk with Dr. Sagorika Malik. Today we are going to talk on a topic which affects millions of women mainly, but even sometimes men. And whether it is you yourself or your loved one or your family or your friend, you will know at least one person who's going through this issue. What we are talking about is breast cancer. And while there has been remarkable progress in terms of treatment and awareness, breast cancer still raises too many questions, fears, and even some misconceptions. Today, I am having an extraordinary guest with us, Dr. Jayanti Thubsi. She is a highly respected breast cancer surgeon, is the lead surgeon breast oncology at Apollo Hospitals, Bangalore. She has operated on more than 6,000 patients, both nationally and internationally, and is passionate about creating awareness on breast cancer. She has seen it all, from the most routine surgeries to the most complex cases. And presently, she is one of the pioneers in robotic surgery for breast cancer in India. We'll be chatting about not only the science behind breast cancer, but also some light-hearted moments that come up during her work. She will also give us tips on what you ask a surgeon if you or your family or a friend ever gets diagnosed with a breast cancer, and how to stay positive through it all. Here, I would like to proudly add that Dr. Jayanti Thubsi is a great friend of mine. Okay, Jayanti, so you're in your scrubs. Looks like you're coming directly from your OT.
Oh, that's right, Sago. I am just coming out of. I had a very long day today. I had 2 surgeries and then I had few patients to see. Yes, and I wanted to keep up the time that I had given you. So I know it's looking weird, but I'm directly from the OT.
Absolutely. And that's going to help dress you.
Oh, thank you.
So I hope you've had your cup of coffee.
Yes. Thank you very much. Thank you.
Good. So, okay, then let's start from the basics, okay?
Yes.
If you have to explain breast cancer to a person who knows nothing about it,
Right.
what would you say?
Right. So first of all, to understand what is a cancer cell, we need to understand what is a normal cell, right? Now, our body is made up of innumerable or millions of cells. And that's the basic structure of our body. Now, each cell has a cell cycle.
Okay.
So it is born in the bone marrow, then it grows in size, it matures, it performs its function depending on which organ the cell belongs to. It reproduces and then it perishes so that it makes place for newer and healthier cells. Now this is a normal cell cycle, which is a controlled cycle. How much can a cell grow or how many cells are born, when does a cell perish is all controlled. Now sometimes there can be changes in this. The control mechanism can be completely lost,
Right.
The control to grow may be lost, or the control to reproduce may be lost, or sometimes the cells may just not die, they become immortal,
Okay.
So in such a scenario, the cells keep growing in size, the cells keep multiplying, and they no more die, And when such a situation occurs, it is called as cancer. Now, if this cell belongs to a breast, it's called as breast cancer. If it's in the liver, it's liver cancer, and depends on which organ it is.
Right.
That is what happens when a cancer is formed.
That's a pretty simple way of explaining such a complex, problem which people go through. Whenever we hear the word cancer, there's a lot of fear and
Yes.
doubts in the mind of the people,
Yes.
right? So, how do you? How do you counsel a patient when the patient comes to you, and the person gets diagnosed as breast cancer for the first time?
Right. Very evidently, everybody goes through the typical phases, like they are completely devastated when the bad news is broken, the so called bad news. In my opinion, it's not after all so bad. But yes, it seems like as if it's the end of the life, it's the end of the road and there's no tomorrow, and all kinds of thoughts come, and especially if they have young children and if they are in the typical age where their presence in the family is extremely important, then it adds on to the complications. So yes, they go through the grief of why did it happen to me, and first of all there is disbelief that it is not true,
right.
and then why me,
Why
and
me?
there are typically those phases that they go through, and then finally comes the phase where they accept it, all right? But what I realize is that when we actually explain the facts to the patient, every patient is much stronger than what we can think of, and they can deal with this emotional turmoil in their life, and they actually acceptance comes. Very often I've seen family members coming and saying, please don't tell this to my mother, she's very weak and she's very, very scared and she will not be able to take it. But I beg to differ there, and I really think that each person should be told what is it that we are planning to do to their body. It is their right to know, and then their participation in the treatment is much better.
Absolutely, and I think that helps the recovery process also in a much better way.
Absolutely, absolutely.
So what is the kind of symptom or sign they come to you with, and because, most commonly we hear is a breast lump.
Yes.
Are cancer lumps painful or painless? Like what?
Right. So lump is one of the symptoms.
Okay.
Yes, lump could be either in the breast or in the underarm region.
Okay.
That is one of the changes that one should look for. Second are skin changes. Skin over the breast and skin over the underarm region. The underarm region is part of the breast tissue. So if there are skin changes, normally the skin is very smooth, but it may seem as if it is pulled inside, or there may be discoloration, there may be redness, or there may be rashes, there may be excessive itching,
Okay.
Or thirdly, there could be nipple changes. Normally the nipples of the breast are pointing outwards, but they can become distorted, or they may actually become inverted, they may point inwards. Sometimes there could be some kind of a ulceration or wound over the nipple which does not heal, or there could be some kind of a discharge coming through the nipple. So there are only three things one should remember. One is a lump, second are skin changes, and nipple changes. Now if you find any of these, it does not necessarily mean it is cancerous. In fact, 80% of the times it may not mean it is cancerous, all right? But 20% of the times it could be cancerous, where timing is very important, and hence we cannot afford to be complacent or to postpone to seek medical help when any of such changes are seen.
Okay, so these are very clear cut signs or symptoms which you're telling, people. So I am sure my listeners would be looking out for those kind of symptoms. And the most important thing is they should immediately visit a doctor if they see any of these kind of changes. So, Jayanti, you have been a breast cancer surgeon for nearly 3 decades?
Yes, that's right.
So, have you seen the change? I'm sure you have seen the changes. What kind of demography change which you have seen in the breast cancer patients? Like, what would you see that what was 30 years back, and who are the patients who are now which you see?
Yes, certainly the incidence has gone up, and we also diagnose it better and earlier, and hence seems like the numbers have really gone up, right? But what I have seen and what is really disturbing is that in India we are seeing lot and lot more of younger patients who develop this disease. In fact, according to the statistics, about 48% of women who develop breast cancer in India are in their premenstrual age group. That means they're less than 50 years.
Scary statistics.
And there are many of them who are in their 20s or 30s, where they wouldn't even have started their family, So we are seeing quite a number of women developing this disease at a younger age.
So that means, all the younger people, all the younger women also should keep this in mind and keep checking their skin and the underarms and the breast for seeing any kind of changes.
Yes, and the diagnosis becomes difficult because the woman herself and the doctor she goes to don't suspect that this could be cancerous. They feel she's too young to develop it.
Yeah, keeping that suspicion for a doctor becomes very important.
Very important, absolutely.
And what do you think? Like, can men also get breast cancer?
Oh yes. So the breast is a very well developed organ in a woman, but there is breast tissue also seen in the men. All right.
Yes.
So though the number of cases in men are lesser, but it does occur in men. We have treated quite a number of men. And in fact, according to statistics, the number of men developing this disease are also getting higher. But if a man develops, we would certainly ask for a genetic test. We would like to know that if there is any mutant gene which is hereditary, being transmitted from one generation to another.
So what kind of transmission, like from mother to son? Or what?
Oh yes, it could be from mother's side or from the father's side. It could be transmitted to the son or to the daughter.
So that means we need to do a lot more in the awareness part.
Absolutely, absolutely.
So, if just going through certain quotes said like, what to say, an intelligent person treats a disease and a genius prevents the disease. So then I'm sure we would all like to be called geniuses and we would definitely want to prevent the disease.
Yes.
So in what way can we create awareness? And one more important question, creating awareness is one thing, but how much is that awareness actually translating into action? Can you talk a little bit on that?
Right. So there are a lot of risk factors which increase the risk of breast cancer which are in our control.
Okay.
There are many risk factors which are not in our control. Right. All right. So the ones which are in our control, we certainly need to take some action.
Right.
And for the others where we have no control, early detection is extremely important. Right. All right. Now, which are the factors which we can control? Breastfeeding. All right. If a mother breastfeeds a child, it is protection for the mother against breast cancer. And there are immense number of studies which have proven this, that a mother who breastfeeds a child for minimum 1 year has reduced risk of developing this disease.
So
Second,
one more important reason to breastfeed, other than the baby,
absolutely,
it is going to benefit the mother
also.
too.
That's right. Secondly, when the first child occurs before the age of 30 years, again the risk of breast cancer reduces, right? Then obesity is another major risk factor, which is like a disease we see these days. Not being physically fit, not being physically active are some of the high risk factors. Smoking and alcohol consumption again are very high risk factors. Now, indiscreet use of say oral contraceptive pills or hormone replacement therapy, and in our country unfortunately even without a prescription one can go to a pharmacy and buy an eye pill or an empty pill or a postponement tablet, etc. But if it is not under medical supervision, it could have long-term implications, and one of them could be breast cancer,
the less you take it, the better it is.
The less you take it, better it is. And if you have to take it, go to a doctor. Let the doctor assess you and decide whether it is safe for you to take or which of it is safe for you to take, rather than just going off the counter and buying it. And also there are some women who have a strong family history of breast cancer or any different kinds of cancers. So these are some of the risk factors which increase the risk for breast cancer. But of course there are a lot of ones over which we have no control, like I said, the genetic factors, or the biggest risk factor for breast cancer is being a woman, on which there is no control. In such cases, early detection is extremely important.
So, how do we do that?
Right. So, very, very evidently, early detection is the game changer in breast cancer. If breast cancer is detected early and if it is treated appropriately, it is almost completely curable. Unfortunately, in India, more than 60% of women reach the doctor for the first time when the disease is already in an advanced stage.
That is so sad.
It is very, very sad, and the reason is lack of awareness. There are so many myths associated, there is fear and a lot of stigma associated with this disease. I have seen, and this no awareness is not only in women who are, say, illiterate or who are in the village. I see this even in educated, in so-called very smart and worldly wise women.
That's very unfortunate.
Yes, that's really unfortunate, and it's just that we are so consumed by life, with the pace of the life that we are going, we have no time to pay attention to our body. Our body actually speaks to us.
It does.
But we have no time to sit and think what is it that going on in our body, right? So just being a little aware of these signs and symptoms is important. Doing a breast self-examination, right? From the age of 20 years, once in a month. All that you have to do is once in a month, and it takes less than 5 minutes. I'm sure women are multitasking. There are a lot of to-do lists, and our health never ever gets a priority because there's really no time. And doing breast self-examination is a very simple thing, and I'm sure making that 5 minutes in the month would be worth it, right?
Absolutely. And can prevent a disease like breast cancer.
Absolutely. And for women who are 40 years and above, I would recommend that you do a mammogram test once in a year. All right.
Okay.
So mammogram is a kind of X-ray we do of the breast,
right,
wherein we can, through the mammogram, we can study the internal architecture of the breast, and very tiny lumps, so tiny that they may be few millimeters in size. They're not even felt when we examine.
Absolutely.
Such a tiny lump can be picked up on mammogram, right? So through health check, which is very robust in our hospital, there are a lot of lumps like these lumps which are picked up, which are just 4 mm and 3 mm or 6 mm, which could be detected only and only because of mammogram. And if the mammogram had not been done, this lump would have grown in size, and who knows, it would have already spread by the time the woman comes to us. So that's the importance of doing mammogram once in a year.
Once a year, right. You seem to be quite passionate about creating awareness.
That's right.
I know that you've written a book called Lump to Laughter.
That's right.
Why don't you tell us something how that happened?
Oh, that's a very long story, and it is quite an accident that it happened. All right. So I'm not a writer. I have no connection with literature except that I read few books, and I love to read books. More than that, my journey in literature ends there. But yes, there was a need at that time, and people around me somehow convinced that I should do it. A lot of my friends who helped me, some of my patients helped me to write the book. Now, what is this book about? I've seen few books which are written for women out there, not like a medical book for doctors, which need to be a little different than a medical book, But I've seen books which were like a textbook, and I don't think any woman would read it, all right?
No,
so I thought, yes.
Yeah.
So I thought it should be like a story, and it was an emotional journey of a woman who goes through different phases of emotions while she is on breast cancer treatment, right from the time when she detected a lump and diagnosed, and the treatment options, etc., the complete journey. And of course, it has a lot of medically validated information in it, all right? And these are real-time stories. These are real patients. Of course, the names have been changed, but these are all real stories which have happened in our OPD and when we treated it, all right? And the book is already in its 3rd edition. We have sold more than 2,500 books so far. Yes. Yes.
Super.
And I think we need to revise it and rewrite it now.
Absolutely.
Maybe that would be the next thing to do.
I also read an article on Times about you creating awareness and achieving some targets, goals. I don't know what.
Right.
So what was that about?
Yes, this is very interesting.
Yeah.
And every time I think of it, I get goosebumps. All right. So we have collected data of the patients whom we have treated, and we have a robust data collection. All right.
Right.
We have complete data of all the women whom we have treated, and as you know, or as you already said, that we do a lot of these awareness programs. Now,
Right.
awareness programs can be physical events where do audiovisual presentations, or these days post COVID we do webinars where the reach is much farther, or we do
Again,
YouTube.
Again, technology is coming and helping.
Absolutely.
You. Absolutely.
Or we do Facebook Live, YouTube Live, Instagram Live, or LinkedIn articles,
Right.
newspaper, TV shows, radio shows. So different ways of creating awareness. So when we mapped the source through which patients came to us, all right,
Right.
we divided all the cohort of our patients into two groups.
Right.
One group was who came to us after these awareness programs, after attending these awareness programs, they realized that, oh, I detected something, and they came to us.
Right.
And the other group is where they came to us because of referral, or they just walked into the hospital or something like that. So what was very glaring in these two groups is that the group in which came to us through awareness programs, 89.2% of them had early breast cancer,
Oh, wow.
where they had an absolute fantastic outcome of the
Right,
treatment.
right.
And in the other group, it was just 56.8% of patients who had early disease, all right? And also in the group which came through awareness, there was not even one stage 4 disease or metastatic disease. So just trying to say that how awareness, or just being aware, or just being educated about this can help, especially in a resource restricted country like ours, where mammogram may not be available everywhere, may not be affordable to everyone, but just having knowledge or understanding of this disease can help in the long run.
Awareness
And,
can work wonders.
Yes,
looks
and this
like.
is a paper that we presented in the World Cancer Congress
Wow.
in the month of September in 2024.
Yeah, I know.
Yes.
You told us that you went for a paper presentation.
Yes.
That's great,
Yeah.
Jyoti. And we can also see that, without awareness, without action, even after awareness doesn't make
Yes,
sense.
that's right.
But the awareness is creating, the suspicion in a patient's mind or
Yeah.
a people's mind, and they are acting on it.
Yes.
And that is creating the wonders.
Absolutely, absolutely.
So, okay. So, whenever we are talking about a health problem, in India especially, everybody has an opinion, and, you ask 10 people, they'll give you 20 different opinions. But I know that there is no such study as such, but in your opinion, and you have been working in this field for the last 30 years, what do you think, the mental health issues which are immense nowadays, the anxiety, the depression, the repressed hurt, anger, those kind of issues, do they have a role to play in breast cancer? Whether the disease is more common in such people, or what about the recovery process? How do you
Right.
feel your patients are going through if they are having a mental health issue?
All right. So I've seen that this is, like you said, there is no study to concretize what you're saying. But yes, I have seen, and probably that should be our next study. How is
Right.
it that stress causes these kind of diseases? Yes, I've seen, breast cancer is mainly a urban disease,
Right.
And urban disease means the fast pace, associated with the stress, and women are mostly working, and they do a dual role of being a homemaker and also working.
Absolutely.
And of course meeting the targets, children to look after, and interpersonal relationships, and things are changing so fast, and to meet, and people do night shifts, especially
True.
in the IT sector. If you
Yes.
see, they work at odd hours and they eat at odd hours,
Absolutely.
the whole rhythm of the body is completely changed. So yes, it does matter, I feel, but I cannot say that there is any study. Probably that should be the study further. But certainly women who are far more positive, who have a positive outlook, recover faster. That certainly I have seen.
Right.
Women who are, people who are complaining all the time,
Right. Right.
who they tend to get problems while treating.
True. Very true.
So your attitude or your mental makeup, does matter. And in these women, their family support from their family and friends is extremely important, especially in such a time where they go through such immense stress levels after being detected with breast cancer. And of course, there are studies which have shown that women who have a strong family support have better outcomes than women who do not have. So family support is equally important.
Right. So you have studies on physical factors, lifestyle factors.
Yes.
You have studies over family factors.
Yes.
Now I think the next study which you need to do, Jayanti, is mental health
On the
factors.
mental health
Just
factors.
as you had studies for awareness, and your
Yes.
study proved that
Yes.
it makes a
It makes
difference. So I'm sure you have the immense data which you have. I'm sure you can
Yes.
find out whether even mental health factors
Yes.
do make a difference or not.
Yes, absolutely,
Right.
absolutely.
What do you say about the kind of technology shift which you have seen over these years? Because now I know that you are one of those pioneers on robotic surgery.
Right.
So I mean, what has been your journey from 30 years back to today?
Right. Oh, technology has immensely grown, and it has hugely contributed to the medical field. Certainly for breast cancer,
Okay.
starting from diagnostics to screening,
Right.
we used to have basic mammograms earlier. Now there are digital mammograms where even small lumps can be easily picked up, and especially in women who have dense breast, that is a very challenging situation that we deal with, where a woman has a dense breast. We have very less imaging options, So digital mammogram helps in those cases. All right.
Okay.
Now PET CT is another thing which has immensely made a difference.
Right.
We can detect if there is any metastasis anywhere else. We can detect how the response to the treatment has been,
Right.
and we can know whether we are right on track giving the right chemotherapy drugs or
Right.
not.
Right.
Now talking about the surgical part,
Right.
earlier days when we were students, every woman who had a small lump or a big lump, their breast would be removed,
Right.
because there was no study to say that breast can also be conserved, So breast cancer or doing radical surgeries was the only
Way out.
only way out, and Halsted radical mastectomy was practiced for more than 100 years, But soon people realized that in spite of doing radical surgeries or extended radical surgeries, there were quite a bit of women who still relapsed,
Right.
And then it was realized after more studies on carcinogenesis, and to understanding the biological changes that happen at the molecular level which causes breast cancer, it was realized that breast cancer is not a local disease, it is actually a systemic disease.
Right.
And this caused a paradigm shift in the kind of surgery we do. So doing radical surgery is no more needed. Breast conservation surgery, that means removing only the lump and safeguarding the breast which is normal, is equally safe as doing complete removal of the breast. So, and as better drugs have developed, the longevity, or the outcomes have really increased, So giving a good quality of life for the women, in fact breast cancer, though the incidence is higher, it has the highest 5-year survival rate, because thanks to all the studies and all the immense amount of research that has happened and the wonderful drugs that have come up, most of the patients do very well after breast cancer treatment. So not only clearing cancer should be the goal, but giving a good quality of life should be very important. So, and especially for women, losing a breast is certainly has a negative impact, Again, I would substantiate it with the studies that mastectomy has a far negative impact on a woman as compared to breast conservation surgeries. So today is an era of doing little is actually doing more, all right. So we do breast conservation surgeries, we do what is called as sentinel lymph node biopsies, oncoplastic surgeries, reconstructive surgeries, and now we have started doing robotic nipple and skin sparing mastectomy. Now in this, there is a very small, almost invisible cut of just 4 centimeters. The skin and the nipple of the woman is kept intact, and the breast, which is enveloped by this skin, is removed from inside with the help of robotic arms, and it is the breast is replaced by an implant with a reconstruction. So a small little cut, the breast is cleared, and also reconstruction is done all in one sitting.
That's so amazing to hear these kind of newer technologies, And it is not only giving good patient outcomes, but it is also taking care a lot from the emotional point of view of a woman.
Absolutely.
If you're able to conserve the breast.
Absolutely.
So you, how many hours in a day do you normally operate, Abhay?
Oh, well, that's difficult to say, but I would say
average, 5 to 6 hours a day at least.
Yes.
So you're spending a lot of your time in the OT,
That's right.
So any anecdotes from the OT would you like to share?
Patient is on the operation theatre, you can imagine it must be so scary for them. There is operating light there just on their face.
Right.
There are immense number of tubes. There are these monitors which are making some different sounds
noises,
and everybody in the OT is in a sometime hurry,
Right.
and the patient feels extremely scared, and most of the patients don't want to start the surgery unless they see the surgeon.
Right.
And I have realized that holding their hand while they are going through anesthesia, when they first give the drug, which is actually going to put them to sleep,
right.
Holding their hand by their primary physician, it makes a huge difference. And somehow the entire surgery goes very smooth, So that is one of the incidences which I would remember. And I remember the Ayodhya Ram Mandir has had such an impact,
Okay.
I remember this patient who was lying on the OT table and we were starting anesthesia, and she kept saying, Jai Shri Ram, Jai Shri Ram.
Okay.
And she screamed Jai Shri Ram and she slept.
Oh my God.
And she remembers this so well, whether you're religious or not, that doesn't matter. But what matters is the faith that they have,
What is your faith?
What is your faith,
Absolutely.
And I always tell the patients, think of good things that have happened in your life when you're going through anesthesia, So yes, and on a lighter note, just 2 days back, okay. We operated on a woman who was 140 kilos.
Oh my God.
With breast cancer.
Serious obesity.
Yes.
Okay.
Huge obesity. And when we do a breast cancer surgery, we remove the lymph nodes in the underarm region. Now, which is called as axilla in the medical terms. And axilla is like a conical tissue which is surrounded by muscles. There's very limited access there.
Right.
And in this woman, that axilla seemed actually like a cave,
Right.
She was so obese. And the nurse who was assisting me was a very thin girl, and her name was Annie. I said, Annie, I'll pack you and put you in the axilla. Why don't you complete the surgery and come out?
I know, you need such lighter moments in the OT.
Absolutely.
I can understand, when you're operating for about 6, 7, 8 hours in a day, sometimes even 10 hours in a day, it must be quite stressful for you too. How do you take care of your relaxation? How do you take care of your stress? What do you do?
Yeah, we need to unwind.
Yes.
I have some amazing friends with whom I can unwind. Yeah.
Right.
I read books.
Okay.
But I've realized that I love what I'm doing. All right.
So you enjoy it so much.
Absolutely. In fact, the days when I don't have work, when I have too much of free time, I'm not in the best of the moods.
Right.
I like to have this balance of work and also free time. Not that I can achieve it always. Yeah, it's more of work and less of free time. But yes, that's the way forward. Right now, I'm enjoying the work, and I think as long as we enjoy work, work doesn't seem like work.
Absolutely. I mean, if you're enjoying your work, then work is play.
Yes.
Absolutely. So, but you don't have any, listening to some music or putting in
Oh.
something, something in the OT which relaxes you and the whole team, like not only you, because everybody is, stressed
Absolutely.
out before a surgery because everybody wants a great outcome.
Right.
For each surgery. So, people are stressed. So, do you have
No, certainly. Music is an integral part of our OT, and I'm sure it's for most of the surgeons.
Yes.
Certainly, in our OT, we have a long playlist, and sometimes, like, okay, I'll play your list and I'll play my list. Our nurses like to play Malayalam songs,
Okay.
and somebody likes to play Arijit Singh songs, and I like more peppy songs.
When we talk about treatment of cancer, we hear the words chemotherapy. I mean, other than surgery, which you do, we also hear the word chemotherapy, immunotherapy, certain drugs.
Yes.
And they do create a lot of anxiety in people's mind, and
Yeah.
sometimes you can have a mind block also. So, how do you counsel your patients regarding that, and what?
I'd like to tell you and all the audience who are listening to this podcast is that there have been a lot of research which has happened wherein the drugs, as compared to what we were seeing the drugs when we were students and now,
right.
these drugs, so much research has happened, these drugs, the effectivity or the efficacy of the drug is higher.
Okay.
It works on the targeted tissue,
Okay.
and very often it spares the normal tissue. All right.
That's good.
So there are a lot of targeted therapies available now.
Okay.
There is immunotherapy available now, and most of the drugs are tolerable. All right. And whatever are the side effects, the
Right.
minimum side effects which are there, they are only temporary.
Right.
They are there as long as chemotherapy is being
Going
given.
on, yeah.
And once the chemotherapy is stopped, the patient bounces back to the normal life. And one of the things that really affects emotionally to a woman is hair loss.
Right.
As of now, there is no solution to it except that you can get a beautiful wig made or the beautiful scarves.
Right.
So, but other than that, that's what I tell my patients, that please just accept the fact that the hair is gone and it will come back. But otherwise, it's a very tolerable.
But sometimes bald can be beautiful also.
Absolutely beautiful.
So,
I agree with you. Yes.
That can be a style statement
Absolutely.
of yours. So, when a patient comes to you, I mean, as you said, you talk a lot, you counsel the patient, you obviously get a lot of history from the patient. And I'm sure you encourage the patients also to ask a lot of questions.
Yes.
So, have you heard, or, some of them are very normal, natural, like, what's going to happen to me and all that. But anything untoward or something which is, struck on you, or something very funny or something totally different any patient has asked you?
So, I like the fact that our patients are more aware, or
that's
they
a good
read
thing.
and they ask me questions and I answer them, And yes, all of them Google search and come for sure. They ask me, why don't you give immunotherapy, or why would you give? The typical question asked is, okay, surgery is done and surgery, everything, all the cancer is cleared. Then why should I take chemotherapy?
Right.
If you're saying
That
all the
everything
cancer
is
is cleared, why should I take chemotherapy? Which is a wonderful question,
And very
in my
valid
opinion.
question.
Very valid question according to from their point of view. So, well, the answer to this is that there is something called as micrometastasis. There may be few cells, cancer cells, which have escaped the tumor, and they are actually circulating in the blood right now all over the body, and there is no scan to pick up few cells which are circulating.
Right.
For a PET scan or a CT scan to pick it up, the tumor has to be a little big enough.
Right.
But if there are just few cells circulating, this is called as micrometastasis. There's no way to detect it.
And those cells can become bigger.
Absolutely, they are micrometastasis today, but they don't remain the same. They grow big in size. So to take care of these cells, to kill these cells, we need to give them chemotherapy. So there are a lot of questions that patients come up with, and I always encourage them to ask more and more questions, so that they feel confident when they are taking the treatment.
Right. And what kind of advice do you give them post surgery? Like, how are they supposed to take care of their physical as well as their mental health and
Right.
emotional health?
Right. So yes, taking care of their nutrition, doing regular exercise, and also calming your mind by doing meditation or yoga, whatever suits them, listening to music or writing or painting, whatever they like to do. I would certainly
maybe chatting with friends?
maybe chatting with friends, absolutely. And we have a robust breast cancer survivors group,
Right.
and there is a lot of sisterhood in them, these patients who are actually strangers, and what is the link to them is that they all went through breast cancer treatment, and they support each other in the whole journey, and we meet once in a while, and we try to address the different issues that they have, and these are the women who actually give hope to the newer patients who come to our OPD.
Whenever I was actually going to ask you, whenever we hear about breast cancer, the breast cancer survivor
Yes.
is a very important term. So, what does that actually mean to you? And as you said, they give hope to the other patients.
Yes.
But in what way do they give that hope?
So the system that we have kind of inculcated in our practice is that when there is a new patient who comes to our OPD, say there is a 30-year-old teacher who is a Tamil speaking teacher, we try to match them with one of the survivors who has gone through the similar circumstance, like say in the similar age group, or she's also a teacher, or she has 2 children like this lady has, or we have planned the particular kind of surgery. And the survivor who has completed the treatment and living a normal life today is actually kind of a hope,
Right.
We may tell the patient that you will do well, but actually speaking to somebody who has gone through that and seeing that they're really, really normal, gives them a lot of hope. And that kind of counseling from them, which comes through their personal experience of going through the cancer treatment, makes immense difference.
So, when a patient comes to you with a breast cancer, I'm sure a lot of family members also
Yeah.
come to you with them, and they also have lots of questions in their
Yes.
mind. So, what kind of advice would you give the family members or the friends that how can they support the person who's
Yeah.
going through breast cancer?
Right. So like I said before, family support is extremely important. Giving that emotional support to the patient is very, very vital. All right. So for that, the family themselves have to accept the entire thing. They need not get overwhelmed, or very often we say that, there is a hearsay story. Somebody said somebody that this is what happens. Oh my God, this is what happens in breast cancer, and things like that. So that, very often I've seen that the fear which is there either in the patient or in the family members is completely fictional. It's all in their mind. There is no basis for it. All right. It's just an emotional outburst. All right. So if you actually replace fear with facts, then comes the rational thinking,
Right.
Then you understand what the doctor is saying,
Right.
and why are they saying, And going through the entire journey of surgery and chemotherapy is not easy, The patient goes through ups and downs, and certainly family support is very, very important.
So these kinds of, just he said this and she said
Yes.
that can create a lot more
Lot.
misconceptions unnecessarily
Yes.
and increase the fears. And that obviously will also affect the outcome of the healing,
Absolutely. Absolutely.
I think our conversation is becoming a bit too serious.
Serious,
Yeah.
yes.
So let's have some fun, So suppose, you're a surgeon and suppose the breast cancer is a person. And, what is the kind of song will you attribute to breast cancer?
Wow.
What is the theme song would you give to breast cancer?
All right. So I think there is one song which has really kind of stayed in my mind.
Uh-huh.
All right.
Okay.
Which is called I don't know, it's Shah Rukh Khan movie, but the song is Love You Zindagi.
Love You Zindagi. Okay. Right.
And it actually, I relate to it because that's the work that we are doing.
Mm-hmm.
The lyrics go that जो जी को अच्छा लगे उसको कहो हाय,
Hi.
जो अच्छा ना लगे उसको कहो बाय,
Right.
मुस्कुराहट को कहो हाय, घबराहट को कहो बाय,
Bye.
you know, love you zindagi.
Love you, Zindagi.
So this is what I would like to tell all the patients, and that is what we try to create in our OPD, that yes, life is still beautiful,
Right.
and all these ups and downs, somebody may have cancer, somebody may have something else, you know, so the ups and downs are part of life, you
Right.
know, but it's worth going through it, worth fighting it, because I really believe
That's a beautiful and apt
Zindagi
song
is
which you
really
have,
beautiful.
yeah. It is beautiful. Zindagi is beautiful, and that's a really apt song you have
Yes.
chosen. I think everybody should make that as a theme song for breast cancer. So, like as I said, Jayanti, we are going to have some fun.
okay.
Okay, so I'm going to ask you some rapid fire questions.
Okay.
And answer it at whatever comes into your mind.
Right.
Okay. What's the favorite day of your week?
Saturday night,
And what do you do?
I just sit and relax. I watch TV, and I sleep late. I binge watch something.
You binge
or
watch.
if some friends are free, I would love to meet my friends.
Do you enjoy getting wet in the rains?
Oh yeah, but it's been so long. I think, you know, I would love to do that.
As kids, we used to love it, right?
I know.
Okay, so, and do you believe in fate yourself?
Yes and no. Yes, because I like to feel, it makes me feel humble if I say that there's something bigger than me. But at the same time, I don't want to give control to just fate, and I'm not somebody who will not take any action and just leave it to fate, you know. So I would like to draw a balance in this, I feel.
So you would like a balance.
Yeah.
Okay. Long drive or curling up with a book? Which do
Long
you?
drive and curling up with the book. I love both.
So after a long drive, curl up with a book.
That's right.
That's right. Okay. If you could learn something new, what would you like to learn?
I would like to do some course on English literature if I would have some time. I regret that I didn't do it in the past.
So you love English.
I love it. Yes. As a language, I love it. Yeah.
As a language, right. Okay. What's your go-to comfort food?
Oh, I think I will go for a vada pav.
Vada pav. Oh.
I'm a total Mumbaikar.
But you have been staying in Bangalore for the
Yes,
last,
yes,
I don't know,
yes,
what,
yes.
25, 30 years?
Yes.
Okay. What do you consider qualities in a best friend?
They call it as a 2 a.m. friend, you know. Somebody in kind of crisis is available. And I'm very fortunate to have some of those thick friends. And even if we don't meet every day, we can just take off from where we left as if there was no time gap.
Finish the phrase. The way to my heart is?
Love.
Love. What is it that fails to make you laugh? Never fails to make you laugh.
Life.
Okay. And I heard you're a grandmother now.
Oh, yes.
Oh, yes.
Oh, yes.
Oh, yes. So you're
Oh, there's fun at home. There's suddenly new life to life because there is a
Absolutely.
new baby there,
Oh,
and it's great to see it growing and playing with it.
lot of hope
Yes.
and lot of
Absolutely.
lot of laughter.
New goals suddenly
New
in
goals
life.
Suddenly,
Yes.
right? You don't look like a grandmother. So, one last question. What's your hidden talent?
I think I can write, which I have not actually.
You have already written. That's no longer a hidden talent. Something else.
No, but I can write
heard
better
you
than
sing.
what I think. Yeah, I used to. I used to sing. Music is part of my life. I used to
Would
sing.
you like to sing a song?
Oh, no, not now. Not now. Thank you. But I would love to listen to song with you, maybe on a long drive.
Right. I think
And hum with it.
absolutely. That's a date.
Absolutely.
Absolutely. It was great, Jayanti, having you with me.
Thank you.
We had a beautiful conversation.
time. And I must tell this to you, Sago, that I've given so many of these kind of talk shows or whatever you call it, but this was so different, all right? This was different because it's a very grave subject,
Yes,
as
it
it is,
is.
and people are already kind of burdened, all right? And to make it lighter and to make it more palatable, or to make it more, tolerable,
Right.
is very important. And I think you're doing a great job, not only on breast cancer, generally on medical illnesses, talking about it, getting experts. And to do an interview of this kind, I can imagine the kind of reading that you would have done, the research that you would have done. And I think at the end of it, you would be an expert in all the fields. Yeah. Thank you for doing this.
Dr. Jayanti, this has been such an insightful and heartwarming conversation. You have shared not only your vast expertise, but also some light-hearted and inspiring moments that really remind us of the human side of medicine. I'm sure the listeners will leave today with a deeper understanding of breast cancer and also a sense of hope. And thank you to our listeners for tuning in. We hope you found this episode both enlightening and empowering. If you know someone who's dealing with breast cancer, remember, you're not alone. You have amazing doctors like Jayanti fighting this battle alongside with you. So keep asking questions, keep seeking support, and stay hopeful. Until next time, stay healthy, stay strong, and as always, keep smiling, because it really is that laughter is the best medicine.